Good morning and welcome. My name is Sarah Hockenbrock and I am the President and CEO of the Greater Dayton Area Hospital Association. We are here today to address the Delta variant's continued impact on our region's hospitals. But before we get started with remarks, I did want to share that everyone in our audience today is socially distanced, meaning that we are all 6 feet apart, and everyone in the audience today is also wearing a mask. Our speakers will approach the podium, take their masks off to deliver their remarks, and then we'll put our masks back on. We're doing that to make sure that you can hear us and so you can see us and see our lips and our faces to make sure that you can get our full message. So again, my name is Sarah Hockenbrock and I am the President and CEO of the Greater Dayton Area Hospital Association. And we're here today to share that our hospitalizations due to COVID-19 are continuing to hold steady at very high numbers that are impacting our organizations and our staff. As of yesterday, October 6th, we had 357 patients hospitalized in the Dayton region due to COVID-19. Another 73 were taking space in our intensive care units across the Dayton region. For the past 3 weeks, since we've recently come together and provided updates to the media, we've maintained 350 to 390 patients in our hospitals due to COVID-19 alone, simply due to that variant, the Delta variant. The patients that we're seeing inside the walls of our hospitals right now are younger, sicker, and are having longer lengths of stay than what we've previously seen with other variants. There's a difference that we're seeing with this patient population, and it's impacting our frontline caregivers. Today, staff are spending more time with patients that look like them, have a similar family or life experience or life circumstance, and today's COVID-19 patient is just as likely as our frontline caregivers to have a son playing in his first high school football game or their daughter planning for her wedding. These are the realities of the Delta variant inside the walls of our hospitals, and it is having a significant impact on the mental wellness and the health of our caregivers. Staff are also getting to know their loved ones, the spouse, a younger child, or the adult parents, and they're helping them navigate the care for someone with a very difficult illness that has no immediate cure at this time. The mortality of these patients is also taking a significant toll. The loss of a patient is something to which our caregivers never become immune. And unfortunately, there's a relationship that begins to form when a longer length of stay occurs, and that loss is felt even more deeply for our caregivers when they experience those longer lengths of stay and building time with that patient and their family. The time has come to help us weather the next step with COVID-19 and the Delta variant as we prepare to also manage our seasonal flu. The change in COVID's nature and impact to our hospitals and the overlay of a flu season means that we need your help now more than ever. Joining me today are leaders from our region's hospitals and our public safety community. Our hospitals are continuing to work with the community and our partners to bolster vaccine uptake in the region, and we've started administering booster doses and are awaiting approval for other types of doses for boosters so that we can shore up the immunity for the entire community. Dr. Mark Belcastro from Premier Health will highlight our ongoing vaccination efforts and the importance of getting your booster shot for COVID-19. Ensuring that parents have the accurate information for our youngest patients so that they can make the best decisions for children's ages 5 through 11 is critical. That's the next age group that we expect to be able to vaccinate in the very near future. And we need to do everything that we can to keep them healthy and safe and in school this year. Dr. Adam Mezoff from Dayton Children's will help us understand what we need to know and do to take care of our youngest patients. And again, for all of us, it is time to prepare for the flu season. And this time we don't have a statewide mask requirement in place to help us stem the spread of germs. Our hospitals and community partners have talked about flu season year after year, and it's a very comfortable topic for us. But we need to make sure that everyone in the community knows and understands how dangerous and deadly the flu can be. Dr. Jeffrey Weinstein from Kettering Health will speak on our ongoing preparations for our flu season and vaccination opportunities. And in addition to our hospitals, we have a group of individuals and partners operating on the front lines of COVID-19 with us, but they're outside of our hospitals. Those public safety professionals and our emergency medical services crews are essential to helping you in the community and making sure that you can get to our hospitals safely. Today we'll hear from David Gerstner, the immediate past president of the Greater Miami Valley EMS Council, to help us understand what the impact of COVID-19 has meant to our EMS crews and our public safety professionals across the region. So without further ado, Dr. Mark Belcastro is our next speaker. Thank you.
Thank you, Sarah. I'm Mark Belcastro, Chief Medical Officer for Premier Health. And before I begin, I just want to ask you if you know a physician, a nurse, or anybody working in the hospital, particularly in the front lines right now, just say thank you to them. Send them a note, write them a thank you, something. They need our support desperately right now. So I'm going to talk about boosters, but before I talk about boosters, I want to also mention what we call the 3-dose series so that you're not confused about boosters and the 3-dose series. So prior to the boosters, if you recall, a recommendation came out for people that are what we refer to as immune compromised, and by that it can mean somebody who's on medications that suppress their immune system so that when they get a vaccine, they don't get as good a response. People being treated for cancer. People are also receiving cancer-like medicines for non-cancer conditions. People that have an organ transplant, and also people can be born with immune conditions where their immune system doesn't act as vigorous. In those situations, what's being recommended by both Pfizer and Moderna is that you actually get 3 doses instead of 2. So if you're in that situation and you're just starting now, you would get a 3-dose series about equally spaced apart. If you are in that situation and had your 2 vaccinations of either Moderna or Pfizer months ago, you should go and get your 3rd in the series. That's not a booster, that's a 3-dose series. So I just wanted to clarify that for you. Now the boosters, which I'll talk about next, are currently only for Pfizer, but we do suspect that Moderna and J&J will have an announcement soon about their booster recommendation. Boosters are not new for vaccinations. Anytime we get a vaccine, depending on the vaccine, whether, example, tetanus is an example, hepatitis is an example. Some of you have gotten the combination of tetanus and diphtheria called DTaP repeatedly, and so that's just an indication that over time vaccination wanes. While if you did have your Pfizer vaccine 6, 7, 8, 9 months ago, it's still helping you right now, but what the research has found is that a booster will help enhance that and bring your levels back up again. And so the booster is recommended for a broad group. The easiest way that I remember it is in sort of 4 categories. The first category would be if you're 65 years of age or older, you qualify for a booster. The next 3 groups are all 18 years of age and older, and I think of it as either you have something, or you live somewhere, or you work somewhere. So if you're 18 and older and you have another disease that might be something like diabetes, a heart condition, a lung condition, a nervous system condition, neurologic condition, and if you're not sure, ask your physician, you might qualify for a booster. The next one is where you live. If you happen to live in a setting that is a group setting, and no matter what your age, some people call it congregate care settings, disabilities, often those people live in congregate care settings, elderly live in congregate care settings, you would qualify in that situation. And finally, where you work, a pretty broad category, if you work in a situation where your exposure to people is more than what we would consider most people do, what comes to mind immediately is healthcare, people in healthcare settings, but also you have to think about education, public transportation, first responders, grocery stores, manufacturing, So there's a lot of situations where you may qualify. Again, you can go to CDC's website and follow the links, and they'll tell you if you qualify for a booster. Boosters are easily obtainable right now through a variety of methods. Premier Health, Kettering Health, go to their websites. They all have multiple places offering boosters, and also local pharmacies offer boosters. So that's a lot of information about boosters, which are tied to the vaccine, which we have been promoting extensively, and we know it's very effective. But I just want to remind you that it's not just the vaccine that we need to battle this pandemic. It's what you heard Sarah talk about, masking and following all the protocols. So it's really a combined approach. So we've sort of slipped on one, and that's why we're in the situation we're in. So I would encourage you all, if you are at an indoor setting, whether you're vaccinated or not, in groups, to wear your mask. And I think that would really go a long way with all of us. So that's all I have. I will now ask Dr. Adam Mezoff to come up.
Thank you, Dr. Belcastro. My name is Adam Mezoff. I'm the Chief Medical Officer for Dayton Children's. And I'd like to give you an update on the pandemic as we see it from the lens of the Children's Hospital. There are three things that I will tell you that continue to give me pause, and then there are at least three things that really encourage me. What gives me pause is that nationally, that children between the ages of, say, 1 and 17 are about 22% of our population, but they're 27% of the COVID patients that we see. Additionally, our hospital, although having slightly decreased numbers, continues to see a significant number of sick children. We average at least 12 patients a day in our hospital with COVID, and of those, 3 of them are in the ICU and 2 of them are on a breathing machine or a ventilator. COVID is still seriously impacting the health of our children. And the third thing that gives me pause is what Sarah mentioned, which is we're combating this pandemic in the face of a season we know is coming where flu will be a part of what we have to deal with. And so flu vaccinations couldn't be more important than they are this year to help keep people healthy. The things that give me optimism. Number one is the national rates of COVID seem to slightly be dropping, although we still have a large amount of COVID in this community, and I am hopeful that that trend would continue. The second thing that really gives me optimism, and mostly what I really need to do is thank the school boards, the superintendents who have helped immensely in our fight to keep children healthy by mandating masks. What we have in our preliminary data shows us that schools that have mandatory masking have less than half the rate of COVID infection than schools that don't. So I want to extend my appreciation to all those schools who are helping us out in this pandemic. And as Dr. Belcastro mentioned, masks are a big part of that. And then the third thing that really gives me optimism is that on October 26th, the FDA will consider emergency use authorization of the Pfizer vaccine for children between the ages of 5 and 11. The data we have seen shows that it is very safe for children this age, that the side effect profile is similar to adults, and that it is very efficacious. That is, it does work well in preventing illness. I remind you that just like adults, children can get long-term complications of their COVID. So as we think about vaccines for all sorts of reasons, we remind ourselves that any preventable disease in children is worth preventing. So with that, I will conclude and turn it over to my colleague, Dr. Weinstein from Kettering.
Thank you very much, Dr. Mezoff. I'm Dr. Jeff Weinstein. I am the Network Patient Safety Officer for Kettering Health, and I also happen to be an infectious disease specialist. I want to shift gears a little bit to influenza, but before I do that, I just want to reiterate the message that although the numbers have gone down a little bit with COVID within our network, and I know with the others in the Dayton region, they're still very, very high. And we may be getting to the downslope of the current surge, but I'm a little worried that we're not going to go down as rapidly as we have in the past due to the fact that really we're not following the mask guidance as well as we should be within the communities. And also, of course, that the vaccination rates are not quite where we want them to be. Now, shifting to influenza. Influenza virus is a disease. It causes a disease that we're all somewhat familiar with, and one of the concerns there is complacency. Oh, flu's not that bad. I don't need to get a flu vaccine. At Kettering Health and across the region, we are preparing and trying to get the word out that this year could be a very, very severe year for influenza. There are several reasons for that. The first one is that because there was almost no influenza last year, and we've had very little influenza across Asia and Australia this past summer, it's very hard for the scientists to predict which antigens should go into the vaccine. So there's concern that our vaccine may not be very accurate this year. However, it's always at least partially effective, and it's important to get influenza vaccine. But the fact that we might not have the best match is concerning to those of us who follow influenza and what it does in a community. The second one is, as I've mentioned, that unlike last winter, the rates of masking and social distancing have significantly dropped off as the recommendations, really both on a local and national level, have been less stringent this year compared to last year. And then the third is the concern that flu and COVID both being present in the community at the same time would be a double whammy. Of course, influenza, similar to SARS-CoV-2 virus, can cause pneumonia. And we know from the early months of the COVID pandemic that patients can have both influenza and COVID-19 infections simultaneously. And that's going to be additive in terms of the severity of illness. So traditionally, influenza may kill less than 1% of the people infected. SARS-CoV-2 is looking at about 1.5%. When you add them together, you're going to have a much higher death rate. The other thing is that those numbers sound very low, but when you look at elderly populations, you look at immunosuppressed populations that Dr. Belcastro mentioned, those individuals have a much, much higher mortality rate from these infections. So it's really critical that we vaccinate both for COVID-19 and for influenza. As we're heading towards influenza season, it's coming at a point where our hospitals are already very, very stressed, very, very full with COVID patients and, of course, all of the patients with non-COVID diseases, many of which had put off care in the last 18 months because they didn't want to go to the doctor or go to the hospital because of fear of COVID. So we're really coming into the flu season where we've got a lot of COVID going on, a lot of the non-COVID, and if we have a bad flu season, that would really strain the resources even that much more so. On a normal year, we would have thousands of admissions to the hospital in the Dayton region for influenza, and nationally, approximately 50,000 deaths every year from influenza. So it's not just a trivial disease. The flu vaccine is very, very available within our networks and within our region. There is not a shortage of influenza vaccine, so we urge people to get their flu shot. And in fact, there's almost no one, other than people under the age of 6 months old, that cannot get a flu vaccination. There are very few contraindications. So we really want to stress that not only do we want people to continue to go out and get their first shots and their boosters for COVID, but we want to make sure that people are aware of and going out there and getting their influenza vaccines this year. Thank you. I will now turn the stage over to David Gerstner from the Dayton Fire Department.
Thank you, Dr. Weinstein. I'm David Gerstner. I'm with Dayton Fire Department. My role there is the Regional MMRS Coordinator, which means that I do a lot of work with a lot of agencies all around the region in terms of disaster preparedness and response. We have seen a lot of fluctuation in terms of run volumes for EMS during the COVID pandemic. In the spring of 2020, run volumes dropped, and Dr. Weinstein mentioned that there were people who avoided getting help for care that they actually needed, and some of them avoided calling EMS when they should have. Recently, we've seen significant increases in run volume in EMS agencies all around the greater Miami Valley region. Some of those agencies are seeing 20 to 25% increases in run volume, and September 2021 was the highest number of runs on record for September in Dayton Fire Department. We are also seeing more patients who have confirmed COVID who are in contact with our crews than at any time since the winter surge last year. Despite that, I have to say that EMS here has not been hit as hard as some places around the nation. We've had reports that there are places where EMS crews respond to hospitals and have had to wait hours before they had a bed that they could transfer the patient to. Even here in Ohio, there have been many places where hospitals have had to go on what they call diversion, meaning that they send EMS crews to other hospitals because they simply don't have any room for us to drop our patients. That has not been the case in the Greater Dayton Area Hospital Association region. But COVID has had a huge impact on public safety around the United States. We have had over 250 fire, EMS, and dispatch personnel who have died from this disease. During the past 6 weeks of this current surge, we are averaging almost 1 death per day in fire and EMS. Law enforcement has also been hit hard. Law enforcement so far this year has had 338 line-of-duty deaths. It always makes the news when a law enforcement officer is shot in the line of duty. But the number of deaths from law enforcement due to gunfire this year are 14%. The number of deaths from COVID are 216. 64% of all line-of-duty deaths in law enforcement in 2021 are from COVID-19, more than all other causes combined. We've had thousands and thousands of other public safety personnel from all of the public safety disciplines who've had to be isolated or quarantined as a result of this disease, and every time that happens, it impacts everyone who's part of those agencies. EMS is also part of the COVID response in other ways. We don't just care for people at the scene and take them to the hospital. In this location yesterday, Public Health Dayton Montgomery County was giving vaccinations for COVID, and EMS was here and was part of that response. We are now looking at the possibility of a treatment called monoclonal antibodies being delivered by some EMS agencies in certain limited circumstances. But I have to tell you very personally that this pandemic has dragged on for all of us. I have been part of pandemic planning now for over 2 decades. I started before 9/11 doing pandemic planning. I never, ever envisioned anything like this. And I will tell you, I'm tired of it. Please, please tell everyone you know, get vaccinated. Get your COVID vaccine, get your flu vaccine, and don't forget, wear your mask. Thank you. I'll turn it over to President Hockenbrock.
All right, thank you to our speakers. And if we can have our speakers join us on stage. Thank you, everyone, for your time and your attention today. Obviously, we have phenomenal leaders and speakers with us today to help answer some additional questions. These are also leaders and speakers who share information and guide our regional decision-making and response. So to each of you, thank you for the work that you're doing. We couldn't do this without you. As we've shared, we're seeing a level of transmission for COVID-19, and we have not yet returned to a comfortable place for our region's hospitals and our emergency response personnel. So we need your help before flu season takes hold. Get vaccinated, wear your mask, and get your flu shot as well. Thank you. Questions? We'll start here and there. Okay.
I want to say I'm so sorry to hear about how the long-term we've been affected. That's really heartbreaking hearing those numbers. Do you know of our vaccine mandates being enforced in the department? How is that going, and what is the rate of people who are passing who are vaccinated or not?
So the question is about vaccine mandates, and that is absolutely differs by each jurisdiction and by each agency in some cases. So there are places that mandate the vaccines, there are places that require vaccine, but if you're not vaccinated, have you tested weekly? There are places that don't mandate it at all. So it varies tremendously. I will tell you that we had a huge number of deaths in 2020 that were largely, there was nothing we could have done. Right now, anybody who gets COVID and dies from it, it is often a preventable death. The COVID vaccine is, and we have physicians here who can say better than I, but incredibly effective. And we still have public safety personnel who have not yet been vaccinated for the same concerns that everyone in the general public has. I tell everybody I know, get vaccinated. It works. It'll save your life. It'll save your family's life. It helps your community. It helps all of us. Get vaccinated.
To follow up, are there plans to create a sweeping mandate as the president of the EMS Council, or is there anybody who could take that?
So Greater Miami Valley EMS Council provides support to agencies around the region in the same way that Dayton MMRS does. Neither agency provides mandates. Greater Miami Valley EMS Council provides the standing orders that paramedics and EMTs operate by around the region, but we don't mandate anything. That is entirely up to each local jurisdiction. But I come back to, we shouldn't need mandates. Folks, it's the right thing to do. It's the right thing to do for me, it's the right thing to do for you, it's the right thing for all of us. Mandates shouldn't be needed. We ought to have people clamoring to get this vaccine.
Yes. Can you talk about the hospitals being stressed? Do you know if the mandates put in place at Premier or Kettering among the employees is contributing to that problem? Or do you have any numbers of how many employees have left because they don't want the vaccine?
We are not collecting numbers at the Greater Dayton Area Hospital Association at this point in time because none of the requirements for vaccination have gone into effect at any of the hospitals in the region. And so currently each of the hospitals across the Dayton region are having listening conversations and education sessions with employees and staff to enforce and build up those vaccination rates and help people understand the pathways for exemption and then understand the opportunities and where and how they can get vaccinated safely by hospital staff who are making those vaccines available. I'll also invite any of our physicians who would like to share any additional comments, but I think that's pretty standard across the region.
Yeah, I will say, speaking for Kettering Health, and I don't have exact numbers, we are seeing an increase in the percentage of employees and providers that are vaccinated, and our deadline for fully vaccinations not till December 1st. We do expect to see that go up at a higher rate. We really do not expect to have a huge loss of employees, although there likely will be some. Around the country, it's been 1% or less of employees that have lost their jobs either they have decided to resign or they have been fired because they've not followed through the vaccination. One of the things that I'd like to stress is that we do have exemptions for medical reasons, and we have exemptions for religious reasons, although those have to be vetted by committees. And we also are allowing those who have antibody that's still present from a previous COVID infection, meaning that they're probably still immune. We're allowing people to show us that, and every 3 months, if they continue to have an antibody that's positive, then they would not need at that time to get vaccinated. So we're accommodating people in several different ways, but as David has said so nicely, it is just critical that everyone do their civic duty and get vaccinated unless they truly have a contraindication to doing so.
My understanding is yes, but I will allow each of them to address if they'd like.
We have a different system. Part of the challenge with antibody testing, as all of us know, is there is no standard that says if your antibody level is this, then you are immune. So we have other ways of doing very similar things that I think everyone else is doing.
And our exemptions and deferrals are similar to Kettering Health also.
Yes.
I have a question for Dayton Children's. We're seeing that Ohio is in the top percent for children in COVID, pediatric COVID patients. Why is that? What is contributing to Ohio being so high?
It's a good question, and I'm just telling you that this is mostly speculation. But you just have to look at the basics that we've talked about all the time. What percentage of kids and faculty are being immunized? Trying to get mask mandates in place. All of those contribute to the high levels. We've seen this here, we've seen this down south. I think the science is clear on this.
Looks like there's one more.
So for Sarah, or for any of the hospital representatives, you guys talked about numbers of COVID patients, but can you give any numbers or talk about capacity that's left per bed? It sounds like we're not yet at a diversion point. Do you have any numbers? And I realize that's also not the percent issue, but a staff issue.
You got right to the crux of the issue, is that over the last 20 months we've worked together as a region to ensure that we can flex up and down in terms of capacity and physical infrastructure capacity to care for all of the patients that this region needs us to take care of. And so we are now at a point where we've gone on for 20 months, and this is having an impact just in the overall ability of our staff to continue going for 12-hour shifts day after day after day. And so we build and flex with the number of staffed beds that we have across the region, and we have the ability to transfer within our networks and then within our entire region to make sure that any hospital that starts to reach their physical or their staffed bed capacity, we can move patients to other locations across the region. So we are not yet at a point where we have maxed our entire capacity, but we are stretching our staff to a point that we need to ensure that as we prepare for what's coming with flu season, we give them some breathing room in order to be prepared for what's coming this fall and this winter.
It seems that we kind of had another spike, I don't know what the term for it is, but are we reaching kind of the valley of that, or is it still wait, I think is what you're saying. Are we still there? Where are we on that bell curve? And also, are we reaching herd immunity? Is it still a long way off?
So two-part question, where are we in terms of our peak and our surge? So we are within our fourth surge, and at this point we are hovering at a very high plateau. we have not come down on the other side of the slope yet, and that is concerning. And we know that we anticipate several more weeks of having to maintain this high level of hospitalization. So that is very concerning. In terms of where we are from a regional vaccination point, we look county by county at what we have accomplished in terms of vaccination started and vaccination completed. And while our vaccination rates continue to very slowly tick upward, it is a fraction of a % every week. And so we are not close to herd immunity in this region yet. The highest counties in our region are probably Greene, Montgomery, and Clark counties, and we are still below 60% in each of those counties. So we still have a lot of work to do, and that's why we're continuing to ask the public to get vaccinated and to continue to wear your mask. Okay. Everyone, thank you so much for your time today. We greatly appreciate your partnership and your support in helping us get this message out. Thank you.